It's May 21, Ukraine Media Center starts its operation. My name is Svetlana Cheperenko, and today we will be talking about the voice of the youth in the social care system, how the state and partners respond to the children's real needs. Let me introduce our speakers. Joining us in the studio are Mariia, Sakuta, Director General of the Directorate of Overcoming Difficult Life Circumstances and the Ministry of Social Policy of Ukraine, Taras Odnenko, member of the DIiMO Office, graduate of the Institutional Care Facility, Kyrylo Nevdokha, head of the DIiMO Office, ambassador of Mentorship, and Anastasiia Stepula, Advocacy consultant at the Ukrainian Child's Rights Network NGO. Good morning, dear friends. Mr. Taras, it's important that during today's discussion we will have graduates of the internet care facilities, the system from the inside, and today from the outside, having certain levers of influence. You are trying to change the things that were working improperly to rectify things that should be rectified. So can you please tell us about the role of the voice of youth, the youth who were staying institutionalized, so their role in changes, and does the state support you in your aspirations? Thank you. The floor is yours. 1, 2. Good morning, all. Thank you for this opportunity to start our briefing. First of all, I would like to start with a minute of silence. Recently, in DIiMO, we found out that one of our colleagues, Gennady, who was a serviceman who was defending us, he was also a graduate of an internet care facility. He was staying in a foster family for a while, and even despite staying in the front line, even from there, he got connected to our meetings. He was supporting our initiative fighting into France.
Дякую.
Thank you. So I can talk around and around, but I'll try to be short and concise. In fact, what we're doing now costs a lot because it seems to me that probably, in my opinion, we were among the first ones who started talking openly, who started telling about the things as they are, talking in ugly manner. When an inspection comes, or some government officials or people with insignia, when they come, we're all looking good, wearing white socks, well-fed, and usually everything is fine. We are well-fed, no restrictions. But as always, the institute is short on funds. The children have nothing to eat. They have nothing to wear. The children are this. The children are this. We need more funds for the medicines. But at the same time, the government allocates the money for those children, and those are significant amounts. So today, I would like to discuss this issue that 95% of the children, they don't know about their rights. They don't know about elementary things. They don't know about the borders. For example, that a tutor is not allowed to touch a girl or to change her. So for them, that's a standard. Everything is okay. The ethics of behavior in those institutions. I've checked 5 different such institutions, and some of them have their own shortcomings. Like, one have good food and bad treatment, the others have good treatment and bad food. So you just stand there, you get hit by a tutor, and it's okay to you because you don't know any better. Probably the things are the same everywhere. You live in that bubble, but as you leave the institution, I apologize for this probably harsh statement, but you're getting spotted by everyone. The government is busy with dealing with other problems. For probably once in a half a year on an Easter holiday, someone calls you and says hello. But after the beginning of the full-scale invasion, I was minor even back then. At the beginning of the full-scale invasion, I was all alone in a dormitory, and I haven't got a single call. There were no people on duty. That was a moment when everybody was thinking about themselves. They only recalled me on the third day. Also, I would like to mention that the mental health support is not sufficient, because back in my day I trusted to a mental health therapist. I told my painful story, and on the very next day the psychologist told the story to the principal, and they started manipulating this story with me. There was no guidance. Like in every institution, the things are different, but again, based on my experience, the things were like that in my institution. And the majority of the graduates or the children staying there, they just got clocked in, and they, when they enter an adult life, they cannot open to other people, and sometimes you open to everybody and you don't know if you should trust that person or not. I don't know how to sieve them. It's now that I'm 20 years old, I'm saying I'm not well socialized, but I'm trying to get socialized. I'm trying to be a support for other graduates of institutional care facilities. When it comes to social support, it just doesn't exist. I cannot say anything in its favor. The majority of the graduates, they graduate, and then after 16 years, they should get registered for free dwelling. The applicants, they know they have something like that, some kind of that right, but they apply to the Center for Social Care and they get rejected. Then the Service in Children's Affairs rejects it too, and I was feeling like a football. I got kicked from one place to another. And when it comes to financial literacy, I graduated from the institutional care facility. I got 10,000 hryvnia, and that was probably the best day in my life. That's probably everything a child could desire. I could go to a barber shop to order any kind of service there, to get my eyebrows cut, shaved, and stuff. And within a week, I spent all that money, and then I'm sitting and I don't know where to get money, because you cannot survive on a stipend, really. So there was no reliable adult by my side who could guide me, who could sit with me and tell me, say, on an example of a candy, how the things are, so that I can have an opportunity to understand what's going on around me. And again, in the advent of the 1st of June, for the majority of the volunteers, so sometimes the volunteers, sometimes they harm the children a little, sometimes they harm children a lot. They come to the institutional care facilities, they provide sleepers, they bring candies, so basic things that the state is supposed to provide to us. And they make a holiday for the children. But for me personally, it's my personal opinion, the 1st of June is not a holiday. It's a day when you have to sit with the children, with the smaller children, and with cartoons, with examples, to remind them about their rights, and from early childhood to tell them that you have a right to do this and that the adults don't have a right to touch you, that you cannot run outside to buy some candies and stuff like that. Thank you, Mr. Taras, for sharing your story. Thank you, Mr. Mariia. Can you please tell us what the state thinks about the situation in such institutional care facilities? What's your assessment of the system function for this time being, and what's its condition during the full-scale invasion, because it brought more complications? First of all, I would like to say that as a country moving into direction of Euro integration, we continue the reform of deinstitutionalization. That's one of the key tasks within the negotiation process. And today we're talking about the importance of engagement of youth into formulation of state policy to change of the processes that exist for the time being. But before I proceed to talking about importance of engagement of the youth in decision-making process, DIiMO is a great example of that. I would like to provide some statistical data. As of the end of the year 2024, in Ukraine, there were around 61,000 orphan children, or those deprived of the parents' care, and among them, 3,422 children were staying in institutional care facilities, and that was a large number that after graduation would require further socialization and support, and very frequently they don't find such support on part of the adults. They don't have reliable adults they can contact with, they can ask for advice, or probably they don't have sufficient level of trust with whom they can share any problematic issues that are of concern to them. And basically last year we've adopted the strategy for reformation of institutional care facilities until the year 2028, and with the operations plan that was attached to it until the year 2026, the participation in the development of the strategy was also taken by DIiMO Office, and one of the key tasks of this strategy is basically the creation of the policies that would be aimed at support of the families and the children and socialization of those children after their graduation from institutional care facilities and reformation of institutional care system. And to make sure that those children have support, back in the year 2023, the Ministry of Social Policy has established an advisory body, the Office of Youth and Children, DIiMO, and basically this office is an intermediary link between the government organizations and the children and the youth staying in institutional care facilities. They've become a link that helps to share those problems that they cannot express, they cannot talk about with their adult tutors. And I would like also to focus on the fact that engagement in reformation of social policy, engagement of children and youth, is not only an ethical standard that the state wants to use in order to have this tick on the paper, like we got them engaged and they submit their proposals, but still it's one of the key requirements in implementation of the institutionalization reform. And basically last year, when we were putting together the report for the year 2023 in the section 3.5, the children's rights, one of the key questions to us as to the state was, how are we engaging the institutional care kids, institutional care youth to that process? Are we really analyzing the problems that they tell us about? And I would like to thank the office of DIiMO, Kyrylo Nevdokha and his team, for being an example of such an intense and, in my opinion, one of the most intense advisory bodies of the youth in Ukraine, who don't only know about the problem, about the way it operates in practice, but they can express their thoughts. They can come to us, other central bodies and authorities, and to suggest the ways of resolution. And on top of that, they have unique experience. The children with an experience of institutional care are people who have a unique experience, and unique experience equals to unique vision. And the DIiMO office is engaged in monitoring visit to the institutional care facilities, and when such monitoring visits are done by the experts, government officials, public officials, then the youth with their experience of institutional care, they have unique experience because they can pay attention to the things that frequently the government officials don't pay attention to, some clandestine moments of the real treatment of the employees of the institutional care, to treatment of the children staying there. Basically, if the children cannot come up to official representative of a monitoring group that represents one of the central authorities, so basically such child can definitely trust to the representative of the youth, which is close to them in terms of experience, vision, and spirit. And on top of that, the Office for Youth and Children, the DIiMO Office of Youth and Children, is the voice of the representatives of such children and youth who couldn't have expressed it to the state themselves, because they understand if they share their problems, they can be punished for that, quote unquote. They can be afraid to do it. They can hide their problems, and basically through such an advisory body, they can feel that they are protected. Also, one of important things is to pave the way to their reintegration and resocialization. DIiMO currently is a big, powerful platform that gets children with institutional care experience involved, allowing them to express their activities, to be heard, and not to be beneficiaries in the processes of government policy reformations, but rather to be partners. And basically, this is what intensifies their activity in the processes of social activity, and it helps their socialization way better than if they shouldn't have been engaged in such processes. Also, I would like to emphasize Kyrylo recently shared that there was a new study of the Brody Club in cooperation with UNICEF, and it was saying that the majority of respondents still believe in myth about orphan children, children deprived of parent care, and I think 67% still believe in those stereotypes, and they believe that such children, after graduation from institutional care facilities, they are antisocial, they are dangerous, and they can pose threat. So basically, representatives of this youth are a brilliant example of the fact that in reality it's not so, that they are prepared, they have ideas that demonstrate to the state what's wrong with the state policy, and they can help change it. And I would like to finalize my address with the fact that all of the countries that underwent the deinstitutionalization reform, in implementation of this reform, they were all engaging youth and children in the DI reforms. Britain, Sweden, and other countries who have already implemented this reform, that was a mandatory component. And us, as a Ministry of Social Policy, we appreciate the input of DIiMO Office for implementing these changes with us. Thank you, Ms. Mariia. It's really a pleasure to hear that the voices of the children from the institutional care facilities are being heard. And there is really a hope that the changes will take place not only declaratively, but will do better in terms of realization. So, Mr. Kyrylo, let's talk more about the plans, the changes that you expect to see, at least shortly, within the next couple of years.
Thank you, everybody. Hello, everybody. First of all, I would like to talk about the demands and the requests. Well, first of all, the first and foremost demand or request from the children from the facilities is to not be there, and maybe being in the care of a family, of a society, or to be at least located not 50, 60 kilometers beyond the city line, but somewhere maybe inside a city, you know. And also regarding the education, we need to talk about the comfort of educational process for these children. However, it needs to be mentioned that not everything is possible to implement as fast as everyone would like to. Because, you know, there is not many people who are ready to take responsibility for the children. And besides, the modern view on these children has to be amended, has to be transformed. And as my colleagues previously said, there is a lot of work in this field, and especially when you visit one of the facilities, you understand that there is a lot of work needs to be done. Like, I must say that some of the processes has already started, and like family type care is already implemented fully in. However, it's not widespread, and that's why there is a lot of work remains. We, on our part, we are ready to do everything that's required to, for example, in this year, next year, especially with discussions like these, we are ready to do more and more this year, next year. That's why we're happy that we have a lot of partners. Like, for example, Ministry of Social Policy of Ukraine, the Organization for the Children's Rights, the government of Sweden, the government of Germany, the European Union in general. They all support the development of the of our project. This project is called Support of the Children that are located in the alternative care facilities, and this concerns not only orphanages, but also half-time, full-time boarding schools, family-type schools, and so on and so on. And all those facilities that are the goal for which is to prepare the children for the adulthood and provide it in a righteous and legal within the legislation of the country. And also, I have to mention that we have different financial support, like for example, from the German government, from the Sweden government, and I'm very glad that people abroad see us, they trust us, and we hope to develop this relationship further. I would like to talk about the office DIiMO that we already talked about a little bit today. Of course, we are not limited to only although it says that engagement of the children and youth with the experience of alternative care, not only those people should be engaged. Anybody who could help in this field are welcome in this program. Taras already mentioned a little bit about the bodies that are involved in this project, and this is child care center, social services, a center of social services. The students of different institutes and educational facilities. Our main directions of activity is the advocacy and popularization of the best interest of the children. I have to mention that in practice, the involvement, my involvement, Taras's involvement, is helping us really substantially, helping us to take part in this project. And there is examples of when people that are graduates from the special alternative care facilities, they become real members of society with substantial weight in society. And this happens only with the help of the education, with the proper education. Like I wouldn't come this far. I wouldn't have come this far if I hadn't finished the high school. I am already a bachelor, and now I'm aiming for a master's degree. And how we are planning to make this come true for all children in the alternative care. And this is legal support, legal consultations. We already have it, but some of the children, they don't get to talk to us due to different issues, like, for example, distrust, lack of trust to something that is that is in the sphere of influence of the government, and everything that is concerning the support of the rights. That has to be covered more, and that's why we are also launching grants for the children, for the and our main goal at this is to make children make children capable of launching their own projects, their own business ideas, that in a way that they could implement it normally without obstacles from the on the part of the state. Also regarding the rights, for example, it's not that I don't know what my rights are. It's that we the children, we don't know how to make it happen. You know, how to realize our human rights, because since our childhood we were told that we have rights for life, right for food, and so on and so on. However, the practical implementation of these rights, how it's done, that's what we don't know. We didn't know. And that is why our project is being created, to help children gain skills, life skills. We will start with a financial education, so that the children, when they graduate from the alternate care facilities, they know how should they spend their money, and for example, when children from some of the social care facilities graduate, they stop receiving financial support from the government because they are receiving instead a high school or a school support. This should not be the case for the children that were orphaned, for example. They have to keep both financial support types. And there is a lot of stereotypes that has to be fought against. Like it has already been mentioned today that there is a prejudice towards the children who graduate from the alternate care facilities. And they have this image of somebody who is asocial. However, we are already working, we're already developing the program that are the main goal of which is to implement the rights of the children that are graduates of the alternate care facilities, so that they could implement their basic human rights in reality. Like, for example, if we compare like normal families, right, and the children from the alternate care facilities, children in normal families, they at 2 years old, they already start, taking after their parents as to how they should spend money and stuff. So we also think that this should be implemented as early as possible in the educational curriculum in the alternate care facilities. We are already working on a pilot project in the Odessa Oblast, and any kind of results that we will have from this program, it will be internalized by this project, and so we are hoping to answer the hopes of the people who are supporting us. There is, as a plan, there is a manual for formation of soft skills for the children and the youth that grew up in the alternate care facilities. And although this is something, like so basic and so general that everybody knows about it, it still needs to be a kind of, made into a guideline so that it could be easily referred to in case of necessity. And in reality, there is a lot of even adults who don't really know how to engage or how to how to get involved in the process of socialization of the children graduate from the alternate care facilities. There is a lot of money at the same time that's being spent by the government in the field of children and youth that require, alternative care. It also has to be mentioned that, like the fact of the children being inside those stereotypes already makes them suffer, like there is children who get into different categories like family type, non-family type, boarding school type, and it is really hard to differentiate between them and which stereotypes are being common for this or that type. That's why and this is why exactly why we need a guideline, a guidance, a manual as to how to work with the children that need alternative care. The next item in our plan is the creation of the manual on mentorship, and we have big plans for this one. This has to include all those questions that cover who needs this, who it is aimed at, who. Like for example, we can, for example, say that the mentorship can happen even during work. Like a senior worker can always spend a little time on mentoring their less experienced colleagues. And this is all. I think this is all about self-consciousness, about being aware. It's about awareness as to that this work is really needed. And we already have. More or less visible results with more younger people. They understand that this is what the children in the system of the alternate care require. Like for example, in this year, this year we will start this work this year, and then we will scale it up. We will try and engage students from high schools, from different educational facilities that have experience of work in the we want those people to stay in the system of alternative care.
Then there is another form, the form of when the graduates of three big institutional care facilities get united. We got them united from all over Ukraine. Last year that was happening in Kyiv. It's a huge support group. When you find support in someone else for yourselves, you establish new ties, new connections, you have someone new to call to ask something. And last year we've developed a position elaborated by the graduates of the institutional care facilities about the institutional care and improvement of the institutional care system. So we've established this position. We cannot attend all of the meetings. We developed it. We've sent it to our partners, including international partners. We have to remind about it from time to time, but it's already a tool itself. Also, there is a community of leaders program. We establish our representative offices in different regions so that they could influence the changes, to get involved in decision-making process in the regions, and also to build capacity of the young people themselves. So those are different information meetings, awareness meetings about mentorship. This is what we already do in coordination with the coordination center. We get all of the possible government agencies involved, because currently the mentorship is not at the level it deserves to be. And first of all, it happens due to the lack of understanding of the fact what is mentorship, how to organize it, how to implement it. And this is what we're doing, and we will continue doing it. Again, you know, it's not that we only want someone to do it, to look for the mentors. No, We've undertaken this obligation ourselves. We're looking for the mentors ourselves. And if you're watching us and if you can dedicate 1 hour a week to a young person or to a child, we will support you, we will accompany you. Please get in touch with us. And then we have a training on mentorship about how to interact with the children, because the mentors also need support and they need knowledge. Then it's about educational activities for the children and youth, what we're already doing. It's about building capacity to get rid of the dependency. And dependency is not only about dependency on, say, alcohol or substances. It's about the dependency on the government, the dependency on permanent need for support, need for help. Currently our activity is aimed at making sure to raise a person so that they can find a way out of difficult life situations by themselves without state support. So that's in short about what we're going to do this year. And to availing myself of this opportunity, I would like to thank the partners. Thank you, Mr. Kyrylo. That's quite an ambitious plan. Hopefully it will be properly implemented. And then I would like to talk about the role of civil organizations, not volunteers who bring socks and candies like Taras has mentioned, but those who really aspire to help the children and the youth practically. So, Ms. Anastasiia, can you please tell us about your organization? What are you doing to support the youth and children who are staying in institutional care facilities? Thank you for having me. First of all, I would like to tell you a couple of words about the organization. Basically, the Ukrainian Network for the Rights of the Children is a coalition of 37 organizations, national, regional, and international, and they are all involved in protection of children's rights. Someone is dealing with legal issues, someone is dealing with the children up to 3 years in the foster homes, someone is dealing with institutional care education facilities. What's uniting us is the aspiration. Like in 2024, we turned 10 years, and for those 10 years, we've been aspiring to deinstitutionalization reform to be implemented in Ukraine. And on top of aspiration, there are some practical things. We unite for the joint advocacy. We're involved in monitoring of institutionalization, both express and clandestine. We get involved in development of the strategy to make sure that this reform happens in Ukraine someday. Also, we partner with the government in implementation of activities aimed at having this reform to take place. And unfortunately, in the same way, within the 10 years, we've been seeing the same problems, the same defects and shortcomings of the system that sometimes change, sometimes become better, sometimes disappear, but talking systemically, they're still there. And first of all, in order not to be too formal, I would like to say that the biggest problem at the root of all vices is that the children in institutional care are not a subject. They are being perceived as an object in relation to which certain activities are exercised. And due to this, the psycho-emotional violence is present at all institutional care facilities. In some facilities, we also documented the sexual violence, physical violence, and even worst types of violence over the children. And this negates any influence of a child on all resolutions related to their lives, starting from what to put on today and what to eat today, up to how to spend their day off, or where to focus in their study, on what to focus in their study. And through this objectivization of the children, we don't see any inclusion of the child's interest. It's mostly done for reporting. All of the children have the same interest in the social care facilities, and also what we observe. So the children are being moved from one institution to another, just like furniture, without asking for their opinion, without providing them with any information support. Why are they being moved? Why is their environment being changed? Why are they supposed to leave their friends? You know, they take you as a sack of potato and they just move you. It's very traumatizing. And through this system where children turn out to be an object, as the children graduate those institutional care facilities at 17 years, in fact, they have very weak system of support. There are no adult like human relations that could support a child. And I would also like to mention what the children themselves deem necessary. Last year, in cooperation with DIiMO and Save the Children International, we've presented an extensive study made in coordination with other organizations about the dreams of the children in institutional care facilities. It may be a little bit romanticized, but the study was about how different is what children need to what is really written in the papers, in the reports. So as we talk about the children, first of all, they want emotional stability. They want to know that they are in safety, emotional safety, psychological safety, which means they can study, they can develop. There are adults who can protect them. They want to have access to information. They want to understand what's going on, what are their rights, what they can do and what they cannot do, not just the bans and restrictions that are never explained, no reasons why one thing is restricted or not. They want to be heard. They want it to be taken into account that if a child wants to study, it should be taken into account. And if a child wants to walk, or just because the tutor doesn't feel it comfortable today, or children are sitting in a wheelchair and there is no ramp, it doesn't necessarily mean that they should be staying in this institutional care facility forever. I apologize for sounding probably a little bit pessimistic. I'm not going to continue in this direction, but for us today, the partnership with DIiMO is a project that we perceive as a brick in a very important foundation where the reform of the institutionalization in Ukraine ceases to be the reform of transformation of facilities, renaming of facilities, change of facilities, and it will become a reform for children. A reform where we focus not on the premises, institutions, name, shape, but where we focus on every single child, their individual needs, and first of all, to do things to make sure that the child preserves their biological or their native family, that the reform is aimed, into creation of a number of guardianships or foster family care types, but rather to be focused on the best interest of the children that we have to focus on as a state in compliance with the UN regulations. But if children cannot preserve their families, they should have the softest conditions, the smoothest resolutions in compliance with the best global practices, so the child can end up in the best care facility, alternate care facilities, so it becomes a step to a permanent care facility, so the children could find new families. And hearing to the graduates of institutional care facilities, hearing to the children who are still staying in those institutional care facilities is an important step to the change of paradigm. Thank you very much, Ms. Anastasiia. Do we have any questions on the floor? Just a small second. And You will be provided a microphone. Thank you. Thank you for this incredibly important and interesting discussion. I'm having a question. Can you please introduce yourself? Yes, sure. My name is Olena. So we have institutional care facilities that were evacuated abroad, and there are Ukrainian children staying there. Can you please tell us what's the government policy in relation to bringing those facilities back to the safe part of Ukraine? And probably you had some monitorings there, or maybe you were trying to study the problems existing there, because children staying abroad, they may forget about Ukrainian language, culture, traditions. So does the government policy exist to bring those children back and to reintegrate them back to Ukrainian society? Thank you. Thank you. Thank you for your question. And in fact, we keep working in this area with our colleagues, with the Office of the Commissioner, and basically the government has developed the mechanism of both evacuation, and we've improved the mechanism for bringing children. Last year, we've amended the resolution 546 that governs the monitoring visits to institutional care facilities that were evacuated abroad, and they govern the mechanism for bringing children back, who are need to be the first ones to come back, how to identify the best interest of a child before making a resolution about bringing them back, whom should the representatives of the facility inform to bring them back. So now I would like to say that within the last year and the beginning of this year, a significant number of kids who were evacuated as a part of institutional care facilities, they were already brought back. And as of today, currently less than 2,000 children are staying abroad. In the beginning of the war, that number was close to 5,000. So now it's more than a half of the children that we've brought back. And starting with the previous year, with the last year, we started making active monitoring visits to every single institutional care facility that were evacuated abroad. And we've exercised the visits to all of the institutional care facilities staying there. Upon the results of the monitoring visits, there is the needs assessment sheet made for every single child. And talking about the children who were evacuated together with the institutions, we keep documenting some problematic issues with their ability, their care. When it comes to key problems, is what you were asking in your question, is the access to education, it's access to specifically Ukrainian education. This is what's really something that matters. Children assimilate quickly, and if we understand that we don't take sufficient care about those children staying abroad to make sure that they have access to Ukrainian education, we understand that sooner or later we start losing such children. And basically that's one of the priorities, to make sure that before their safe return we could take care about their development with access to Ukrainian education. Meanwhile, they are still staying there. And also, I would like to add that last year, as we were making amendments, we were focusing on the fact that after needs assessment, children staying in the institutional care facilities should be brought back to foster families. So we've minimized that possibility of returning to the institution from an evacuated institution. And currently in the resolution 546, it says that making such a resolution is only possible in case of any risk for the children staying there. And such risk can arise in relation of lack of funding for their further staying there, or the jurisdiction of a country may be spreading over those children, and there is a risk that those children may stay there further on. Thank you. Any more questions on the floor? And you mentioned about the challenges and the problems where the children stay at the institutional care facilities 24/7. And in case of Taras, Kyrylo, the graduates, we know that probably today and mainstreaming of the sexual education that should be implemented in schools and institutional care facilities. Can you please tell us whether you had any subject as you were studying, or some of the adults or seniors were explaining it in some normal terms, or was it some taboo topic that was just passed by, which resulted in further some problems or misunderstandings? Well, look, in the in the institutional care facilities, just like in the Soviet Union, there was no sex. And we know that as a result of the absence of the social education, there are cases of impregnation of minors. The children enter into a sexual intercourse, and it's happening not in a healthy understanding of how it's supposed to be, and such cases are documented. So one of such cases was documented in one of the institutions in Lviv region. So again, it already is a parcel for difficult life conditions. Hopefully we will be able to support the mother, because the father rejected his parentship right away. So there is no such subject of sexual education. There is like a natural science where the children study the body, but again, the tutors during the education hours, probably they could do it, but the specialists who could properly explain it just are not there. And when a tutor is telling you this rather than your father or mother, is being perceived in a very different way. And let's be honest, we were just laughing at that information. First of all, it was not presented in a proper way. And second, the fact that there is a tutor and there is a child, the ranks, if it would have been my father or mother explaining it to me, then it would have been perceived in a different way. But again, that's a difficult thing to explain, and hopefully we may figure it out with the Ukrainian Network for Children's Rights. We were already thinking about it, and as an office of the Ministry of Social Policy, and as a Ukrainian network, I will answer on their behalf. We will probably plan it for the year 2026. We are going to pilot the financial literacy, and then we are going to reach out to them with sexual education. Thank you very much. We were discussing the way that the government reacts to the problems of the institutional care facilities and children and youth. Stand there. Thank you for staying tuned. See you next time.